Hello, my name is Donisha, and today I will be talking to you about solution-focused therapy. What is solution-focused therapy? Solution-focused therapy is a theory that has been used for many years on a different variety of clients. The main goal in solution-focused therapy is simply what it says, to find a solution. It's when a client and a therapist join together and try to find a solution to a problem or an issue. There are two major concepts within the approach of solution-focused therapy. One is de-emphasizing problem talk, and the other is emphasis on solution talk. Within the de-emphasizing problem talk, the therapist tends to minimize all the negative comments that the client may bring in to a therapy session and gear it more toward the positive solution talk. And this is where the client will gain insight to their strengths. It is important for the client to recognize that change is constant and change can occur, but only with positive reactions. Some principles that are included in solution-focused therapy is externalization, exception questioning, miracle question, scaling questions, and surprise task or intervention task. First, we're going to talk about what externalization is. One example of externalization is when the client comes into a therapy session and they may say, well, I feel depressed. The therapist will then ask the client, well, what does depression look like? Or what does depression feel like? Through asking those questions, the client is able to should be able to distinguish the difference between being attached to depression and being detached from depression. We now see depression as a external factor, or not being connected with the human itself. Following the externalization, we may use a technique called exception questioning. This is when the therapist will ask the client, well, can you remember a time when you did not feel depressed? What time was this? What was going on during that time? This allows the client to see that there were times that they were able to overcome their obstacles or their challenges. One thing that may follow exception questioning is to ask a miracle question. Within solution-focused therapy, we like to use the miracle question as a method of trying to see how the client can progress or move forward. So an example of a miracle question goes a little like this. If you woke up after a night's rest and everything in that day is perfect, what changed from the night that you went to sleep to the day that you started a new day? What changed? What would be different for you? The client may say that they found a new job, or they found that they were not depressed anymore. This gears the approach into a positive direction for the client to see that there are some good things out there, and it builds hope and a reason for change. One thing that may follow the miracle question is what we call in solution-focused therapy a scaling question. Scaling questions are used from a scale from 1 to 10, with 1 being less likely to do something and 10 being the most likely to do something. The therapist would ask the client, Well, how willing are you to move toward change? How much do you want change on a scale from 1 to 10? And the client may say, well, I'm willing to move to make a change about an 8. Then the therapist will clearly see that they are ready for change because the number was such in high rank. The next thing that a therapist would ask the client after getting the answer back from the scaling question is to ask, what is the next step? What are you going to do next in focusing on your moving toward a positive outcome? This will help the client to focus only in a positive way and minimize all negative aspects, period. We also may ask the client in solution-focused approaches to write down some times of their day that are going good for them. These are called intervention tasks. And we also use methods in solution-focused therapy called surprise tasks. And these are mostly used within situations where the client may be a child and having a problem with their mother. So a surprise task would be to ask the client to do something good for their mother. Within the next session, the client would tell the therapist what they did. And it would have to be in a positive way. So solution-focused therapy is a great approach to finding change within the client and giving the client a sense of hope and feeling empowered. Solution-focused therapy is used in many different ways and in many different places. And it is a great way to make a difference. In the next video, there will be a role play in how we may use a solution-focused approach. Thank you. Hope you enjoyed.